Good afternoon, Unite for Her community. Welcome to our July Ask the Experts. So we are so excited to have two experts with us today that are innovators in the space of cannabis in oncology care. And if you missed our speaker series with them earlier this spring, be sure to check out that recording. There was so much good information shared. We have the slides available to you. So we're so excited to have our experts back today. But before we jump in, let me introduce myself. My name is Erin. I'm our Senior Director of Culinary Nutrition and Education, and often your host in these virtual education segments. And I'm so excited to be here with you today for this really wonderful discussion. We've received a ton of questions ahead of time from our community, but know that if you are watching live on Facebook, you're welcome to submit your own questions as well as we move through the discussion. And we'll do our very best to get through as many as we can in this 45 minutes. This will be streamed and recorded. So if you have to hop off early or you want to come back and rewatch, know that this will be available in our video library as soon as perhaps later this afternoon. I want to share my screen because we are coming upon August. We've got some fun events to look forward to. So we have our virtual hangout happening next Thursday with Dr. Eleonora Teplinski, talking about cancer and survivorship guidelines. So be sure to start submitting your questions for that as well. We are featuring 2 summer book series as part of our virtual hangouts in August. So be sure that you are hitting the library or listening to your audiobook for Anti-Cancer Living. And then again, later this month, Healing and Cancer, which is a new book that came out earlier this spring. Both of our virtual hangouts will be kicking off with our summer sips. Hopefully you've been following along with our zero proof mocktails that we've been featuring all summer long. And then we have Melissa Rosen from Sharsheret talking about managing cancer risk within the Jewish community and also sharing the amazing services that they offer as well. We are so pleased to have them as a partner with us. And then, of course, all of our digital education events we would not be able to bring to you without our amazing sponsors. So I want to be sure that we thank our presenting sponsors, West, Merck, and Daiichi Sankyo, with additional support from GSK, Lilly, Gilead Sciences, and Immunogen, now part of AbbVie. So be sure to tune in. We are so excited to bring you these discussions. But with that being said, I want to jump right in to our segment for today because frankly, we have a lot to cover and a lot of questions to answer together. So first, I want to introduce Dr. Brooke Worster. She is the Director of the Division of Supportive Oncology and Medical Director of Cannabis Medicine for the Science and Business Master's Program at Jefferson Health here in Philadelphia. And then we have Greg Garber. He's the Director of Oncology Support Services at the Sidney Kimmel Cancer Center. And again, we are so excited to have both of them back with me today. Thank you both for joining me. We are thrilled to have you here to answer our questions and shed some light on cannabis in the oncology setting.
Thanks for having us.
Yeah, thanks so much. Looking forward.
Absolutely.
Yeah, this will be great. I'm in a room that is like a meat locker, so I borrowed someone's sweatshirt. I'm in clinic.
That's okay. We understand the hospitals are usually colder than everywhere else. Wonderful. Well, I want to start a little bit talking about safety in cannabis, because I know a lot of questions that came in really just were about the safety of taking these medications. And I think a good place to start is touching on the research when we start to look at studies in cannabis use. And we know a lot of those studies are observational instead of clinical. Why is that? Why aren't we seeing those more clinically focused research studies?
Great question. I'll dive into this one first, Greg. The real reason in the United States that prevents more robust kind of interventional clinical trials is because at this moment in time, the federal government still looks at cannabis as what is called a Schedule I drug, which means it is an illegal substance, right? And so that prevents either funding or handling or possession of a illegal substance for, it doesn't even matter if it's for clinical trials, unless it's under very specific circumstances. So most of what we see are survey-based things, kind of retrospective reviews, observational studies. That it's not nothing. It's just not the robust evidence we'd love to have.
Okay. Yeah, and that makes sense. And I know a lot of the studies we see, they come from populations or patients that are from overseas. And is that research that we can lean into perhaps to give us a little bit more insight on the efficacy in different scenarios?
Yes, sure. Right. I mean, I don't think it matters geographically where you are in terms of outcomes as much as it matters, in the other kind of demographic material that we're collecting, right? Is this a person that is around your age or race or sex and has your type of cancer or other underlying illnesses? Yeah. In terms of comparing apples to apples, that matters a lot more to me than whether they're in New Zealand or, New Jersey.
Yeah.
And
yeah,
other countries, some other countries with socialized medicine have kind of nationwide registries too, which makes some of this research a little bit easier in other places. So there's that as well.
Wonderful. Good. So we'll be on the lookout for some of that research that comes out and continue to pool some more data, to support the cause for sure.
Yeah. And it's happening. I mean, just today there was in Nature, which is a very good journal.
Yeah,
it was small, but it was a placebo-controlled interventional study looking at a very specific population, and one of the parts of the cannabis plant called CBG as it relates to anxiety. And so that gave us another pebble of information along the path, right? All of these things kind of combine to make the mountain of research that we want.
Yeah. Definitely. We need all of that for sure. Everything is worthwhile. Mm-hmm. So in terms of, for those and a lot of our community that want to start using cannabis for a variety of different side effects, again, that safety component is something that we're hearing is of real concern. And so we've received a lot of questions regarding the safety of cannabis use for different types of breast cancers, if they're on different types of medications, chemotherapies, immunotherapies. So can you speak a little bit to, is it safe if you have hormone receptor positive versus triple negative? Does the type of breast cancer or ovarian cancer for that matter, matter in terms of whether it's safe to use cannabis?
Greg, I actually, you sort of said it very, very well in relation to the breast cancer in one of our prior conversations. I don't know if you want to tackle that first.
I wish I remembered what I said. Like this is what happens, now.
Yeah.
I'll defer to you, Brooke.
Okay. So here's the answer, right? Is that the jury is still out. And what I can tell you in terms of very large population-based registries, we do not see that there is any detrimental impact in terms of whatever type of breast or ovarian cancer you have, and either regular or irregular cannabis use in terms of worse outcomes, more progression of disease, higher risk of having cancer itself. What we do see are signals from basic science studies that look at the interplay in either cells or animal models and show that there can be potentially a interaction with some of that hormonally positive breast cancer cells and cannabis. So we've seen that all the time, right? We see it with sweet and low and chocolate and wine and all of these things that, it is a pebble and it matters. But, as we keep looking, a lot of that doesn't play out in terms of true risk. So for what and then some of it does a little bit. Like I just saw a study the other day that had nothing to do with cannabis, but it was like a very specific type of infusional chemotherapy that they found that there was an interaction that now they're going to say you don't drink orange juice when you're having this. Like it's kind of a micro scale, but this happens, right? So for now, if you are a woman or a man that has a hormonally positive breast cancer, please, before you dive in heavily into any kind of cannabinoid-based medications, have a discussion with your oncologist about it. Like that's the best advice that I can give you. I will tell you, There is nothing out there that I can lean on as hard evidence that to say that this is an increased risk, but there are things that need to be evaluated individually in you.
Okay. That's really great advice. And so taking that a step further to the type of medications that someone may be on, I guess the same would be really unsure if there's any particular interactions between certain conventional therapies, like I said, immunotherapy, hormone therapies. Is that the case?
Greg, what were you going to say? I'm sure.
No, I was
sorry.
The other thing to remember is, like, since a lot of this is population based, cannabis has been around for thousands of years. And so there hasn't, and while they may not have looked specifically at that, we need to ask ourselves, all right, people didn't just start using cannabis with hormone positive breast cancer or, immunotherapies just, in the past 5 years. And so, no huge signal has emerged that would kind of speak to the fact that that there's something kind of perilous there. So just to
compare it along those scales, that's a perfect analogy. Like, think about nicotine, right?
Yeah.
Like, very quickly, I should say very, relatively speaking, I say very quickly, but like years and years and years, decades, right? Doctors were handing out cigarettes to people to calm them down or to, whatever. And then we saw a signal when there was a real signal, kind of quickly and irrefutably. So I think a lot of that historical perspective is helpful in this so that you don't feel panicked.
Yeah. Oh, no, go ahead. Sorry. I was going to say that's actually a really perfect analogy, Greg, because I think this creates a lot of emotion and response in terms of could there be a potential risk, but when you're able to take that step back and look at the big picture in comparing both of those scenarios, that makes very clear sense.
I think over the years, having seen many patients with breast cancer, that people want some control over things and want to kind of understand the environmental impacts of things. And there was a little article on aluminum pans a while ago, and an article, as Brooke said, about artificial sweeteners, and people kind of categorically removing things from their lives without kind of some decent evidence to support that. Rebuying your cookware is a bad idea, but you get what I mean. It's
yeah, absolutely.
I think we do have at least a good sense in terms of drug-drug interactions. It's certainly not fully fleshed out, but that's a little bit easier to understand, right? Because you can kind of study it in a controlled sense. Does cannabis change the levels of any specific drugs, right? And so while we've not seen that it ever affects the levels of any kind of cancer treatment per se, the one category where there again was a signal, and this came out of, talking about international things, this came out of a paper that was published out of Israel, that looking at a cohort of patients that were getting immunotherapy for various types of cancers and were regular cannabis users, there may have been a trend towards sort of less robust response to the immunotherapy than those that did not report using cannabis.
Okay.
And that interplay makes sense, kind of thinking about the body and the pathways and what we know about cannabis and your endocannabinoid system, because it does have an interplay with your immune response, right? Or the inflammation in your body. And that's all of what immunotherapy is kind of hinging around. It's why your oncologists are telling you, don't take ibuprofen all the time. We're not going to give you steroids. We want to avoid that because we don't want to do anything that like shuts down or dampens your immune system. So that's another signal that we are continuing to investigate. I mean, and people are attuned to it. And so we will get more data. We have a clinical trial that is accruing patients that are looking at that same thing over time.
Wow.
So, and there's other people that are going to do that in various ways, going forward. So we will get more robust data on that, but that's a symbol or a signal that I would tell you again, ask your oncologist, right? Yep. And it's very focused on CBD in this case. And there's even been some guidelines about saying, like, if you're on immunotherapy, there should be a max dose of CBD that you have a day. And that's fine in terms of being precautionary. Again, like, you don't have to wholesale panic and avoid this in all ways, but have the conversation.
Yeah. Yeah. And it's really good to have a trusted organization like yours that's clearly not only sharing and educating, but doing some of the research that hopefully over time will give us some more specific guidelines, understanding. And I want to make sure that we put that link in our chat as well. So for anyone that's watching, if you want to connect directly with the staff at EO, you can do so with Unite for Her. So we'll be sure to share that as well. But that's really good to know. So speaking of form dosing, let's shift the conversation a little bit to, the varying types and forms of cannabis use that are available to patients. So specifically starting with THC versus CBD. What's the difference? What are they each good for? Could you shed a little light on that?
Greg, do you want to tackle this? I've done it a million times.
We'll tag team. Yes,
it's good.
I like it.
Certainly. So, cannabis is a plant, and it has hundreds and hundreds of compounds in it, being a plant. And the two major compounds that we talk about the most are THC and CBD. THC being the compound that can make you feel high, and CBD kind of thought about as an anti-inflammatory compound, but also can be calming. It can help people sometimes with sleep. It can help people sometimes with anxiety. We're kind of watching the evidence mount. Generally speaking, the thought is that kind of when we kind of use compounds that are closer to the natural composition of the plant, when we're not just splitting out one compound, we get more of what they call the entourage effect, the effect of all the different compounds there. So often our patients, we will recommend that they use some ratio of THC to CBD, depending on what they're trying to treat and what their tolerance is for feeling a bit high. And so some THC is needed for some things, like it helps certainly with pain and appetite and nausea. And the CBD can temper that a little bit when they're given together. So products come in a whole variety of strengths and ratios. So you can get a 1-to-1, which is 1 part CBD to 1 part THC. You can get a 10-to-1, an 8-to-1, a 5-to-1. There are lots and lots of different preparations out there. There are many other cannabinoids that you will read about, as Brooke mentioned earlier, CBG, CBN, THCV, THCA. Wow. There are lots and lots and lots of them. There's a kind of a slide we put up. It's probably in the earlier talk that we gave. And a lot of them may be interesting. We just don't know an awful lot about them. So kind of sticking with THC and CBD content to start out seems to make the most sense.
I feel like as a very general rule, like almost everything in life, right? There is a very wide spectrum of products that you can access with different compositions and potencies and all of that. And it's like a bell curve, right? And in the middle, it's the ones that are sort of not wildly potent in just THC and not wildly potent in just CBD. And that's probably the thing that is most tolerable and safest and kind of a smart place to start, right? The stuff that gets on the very sort of extreme ends in either place, that's where I worry about complications more for people.
Yeah. And I'm glad you pointed that out. One of the questions we got from our community was, just about sort of that ratio. Can CBD without a strong THC still work?
Yeah, I mean, yes, there is evidence, and especially depending on what you're trying to treat. I think increasingly we're seeing that a little bit of all of it is better than none of, like zero of anything else and just one isomer, just the CBD or just the THC. I think the place that Greg and I get asked all the time in clinic and when we're doing webinars like this and something is like, just tell me what to use, right? Like, what product should I be getting, right? And that's the sort of golden nugget that I feel like most people want and they're struggling getting. And that was kind of how Greg and I got connected to EO as this like very tangible, very specific, personalized guidance of like, that's what you want, because it's impossible for us to see everybody in clinic. And, there's not a lot of very tangible guidelines out there. It's not like, a very specific answer on this weight-based dosing of this infusional 5-FU, right? It's just not. And so there is ways to get kind of a very specific care plan out there to help you. And that, I think, in itself can relieve anxiety about risks and, complications or not liking it or spending a lot of money that feels stressful when you're in the midst of all this other stuff.
Absolutely. It's the control thing that you provide to patients 100%. So they feel calmer about the whole thing.
And it gives a structured approach. I mean, most people going through cancer care are used to either getting infusional medicines or going into a retail pharmacy and getting a bottle with a written out, take one of these in the morning, one at night, here's the strength. And so wanting to kind of align a little bit, not that we'll ever kind of get exactly there, but wanting to align a bit more with that, where there's a schedule, there's a process, there's a thoughtful structure around it, which enables also not, rather than having kind of a pile of different products from a dispensary that you bought sitting there and just kind of picking one up each day. If you do something systematically, it's much easier for us to provide guidance, because then we can comment specifically on, okay, so you tried this and this seemed to be a little bit effective, so it makes sense for more of this. It wasn't helping with this. Do we add this? And if we do this systematically, as we do in all kinds of prospective research, I think we get a better result. Hopefully.
Absolutely. Yeah. And it's good to know that in the cannabis space, we're moving in that direction to begin with, because I think sometimes when the general public looks at cannabis use, it's like the Wild West. And so when you're looking at it for assistance for a medical diagnosis, it's nice to know that, we have experts and an industry that's looking to organize it, create structure, create some organization around it.
Oh yeah, because for a very long time, and this is true of research that was done around it too, it was like cannabis or no cannabis, right? Like it was one entity. Like I'm just talking about like a very defined, orange Tic Tac, and every single orange Tic Tac is always going to have the same thing and the same, right? And that's just not the case, right? So this allows us to look at the complexity of the substance and give kind of meaningful both outcomes research and guidance to people in real time.
Yeah, that's wonderful. So thinking of forms, a lot of the questions that we received from our community were around a particular form. And what I gather is, for many of us, we think if we're going to have cannabis use, we're going to think of, how we may have enjoyed it in college or something, right? So in other words, we're smoking it. Some of the questions that came in were around, well, what if I have mets to the lungs, I have lung involvement, or what's the healthiest way to ingest it? Is it only smoking? So can you speak to the different forms that really are available to patients?
Absolutely. Do you want to tackle that, Greg?
Sure.
Okay,
we have certainly, this is not your college cannabis anymore. There are the little, not even a Ziploc bag, but the old ones that used to fold over, right? If anybody remembers that. But I was speaking to one of our patients this morning who had just gotten his card, and he wanted some education on that, and he had not used cannabis in probably 30 or 40 years. And I went through a dispensary menu. He's going to go through the EO platform, but I was describing products, and you can ingest things in a variety of different ways. There are sprays, there are edibles, which are called troches in Pennsylvania, and they're gummies in New Jersey. There's all kinds of food products. Pennsylvania doesn't have a ton of them, but many states do. There are tinctures, which is essentially the cannabinoids that are dissolved in an oil that you can kind of put under your tongue that get absorbed through your oral mucosa. There are balms, topical preparations that people may find helpful for neuropathy or other kind of local pain. So you don't really have to smoke this to get the benefit. They're also working on technologies that one of the things for anyone who's ever ingested cannabis, had a gummy or some other kind of chocolate or edible, is it takes longer to work. And so anywhere between 45 minutes and, maybe a couple of hours. And so when you're feeling really lousy, kind of waiting that amount of time, is tough. The THC molecule is large and it takes a while to kind of get in there. But they're coming up with newer technologies that hopefully make that absorption of ingested products faster. Jury's out. We'll see. Hopefully, I think we'll get there. There are also inhalers, meter dose inhalers, which are really interesting. You know, it's not smoking. It's like an asthma inhaler, which is, you know, really cool. So you don't have to smoke. For people who don't have lung involvement, if people really want to smoke, we would always recommend vaporizing oil rather than smoking the flower. Just something about burning a plant and sucking it into your lungs is just probably not a good idea, right?
Yeah.
But when the oil is distilled for vaporization, it is certainly purified during that process. So you're not getting fungus and other impurities that are in there. Still can be an irritant, but the onset of that is so fast that for people who have a fair amount of nausea or want to do something just before they eat, it is not a bad way to go.
Good. And it's good to know that there is that variety available. I know one of the questions that came in was just the feeling of nervousness or anxiousness based on experiences in the past.
Yeah.
So for anyone that may not be comfortable ingesting or taking a gummy, there's other options that they could speak with their physician or the person that they're connecting with at a dispensary about using.
Absolutely. By and large, and again, right, this isn't personalized, this is very general, but for those of you who have tried cannabis recently or in the past and had a bad experience, meaning most of it is like the things that people don't like is when they feel like paranoia or anxiety.
Yeah.
A lot of that is driven by the amount of THC that you have, right? And so being cautious and sort of wading in the baby pool, look at and get a very specific recommendation with low THC. There is tolerance that develops over time, just like with anything, right? When I prescribe opioids to someone, how they feel with that first dose, I tell them that's not how you're going to feel 2 weeks from now. And there is beneficial pain relief that can be had, right? So hang in there, start very low if you're worried given prior experiences, and then kind of we could slowly build up to a dose that feels a little bit more effective for things.
Perfect. I love that. I think that stepping stone approach for anything it makes us feel much more calmer. And Greg, you had mentioned earlier talking about the different topics, a topical, and we had a question that came in from one of our Facebook viewers. They're taking letrozole, dealing with a lot of joint pain. We hear that often. So topical cannabis, is that something that could potentially be effective?
You want to take that, Brooke?
Sure.
Yeah.
So topical cannabis is fascinating to me in this way that we don't have like amazingly good data in terms of which products are actually getting good saturation and some kind of presence in your bloodstream, right? Which is kind of what you need, or even presence in a deep joint. That being said, I would tell you what, Greg, it's probably a 50-50 or a 60-40 response in terms of patients that come back and say like, oh my God, this was a miracle. And others that say like, I didn't really have any response. Here's what I will tell you. And especially with like the letrozole and the joint pain that is kind of this diffuse joint pain that happens in multiple joints. Yeah. It's really tough to rub a concentrated kind of product all over your body or hit a ton of joints. So it tends to be less effective when it is pain that you're feeling all over or multiple places, right? And so in that instance, I say you probably want to try something that you're ingesting or inhaling in some way. You can combine it with a topical, especially if there's a very localized, like I really feel it in my knee or my low back or my elbow, my fingers, some people say, right? And it tends to be, think about it this way, like the joints that are closer to the surface, you have a better chance of having direct penetration there. Like when people tell me it's their hip or their like pelvis that they feel pain, like you're not, it's just your body is not meant to absorb things that deeply, right? Or else we'd all be sponges. And when you got in the back, you'd blow up. So you're not going to get actual absorption to your hip. That's where think about taking something that you're ingesting and is truly getting absorbed into your bloodstream.
Yeah, that's a really good point. Okay. So potentially, but again, another reason just to speak with your physician about what potential options are out there and even collaborations that someone could use to help their side effects. So with that, I do want to shift the conversation a little bit because we got a ton of interest around side effect management. I mean, this is why, patients will speak to their physician or pursue getting their medical marijuana card. So generally speaking, what are all of the things that cannabis could potentially do for a breast or ovarian cancer patient?
Statistically speaking, and then Greg, you can please speak to like what we see and what people are kind of wanting to use it for and what they're seeing. But statistically speaking, without a doubt, the top three kind of reasons or symptoms that people use cannabis are pain, sleep, and anxiety. It's like far above anything else.
Wow.
That being said, I actually think the impact or the kind of benefit in terms of especially our breast cancer patients and other cancer patients going through treatment, it's probably not quite aligned with that as much, right? We see people all the time, and I think it's pretty darn effective when people are struggling with nausea and vomiting and the traditional prescription meds are not getting it done.
Yeah.
That is kind of where a better body of evidence, frankly, lies. And even ASCO, the American Society of Clinical Oncology, came out and said, like, think about that, there's some evidence to support this for nausea and vomiting specifically.
Wow.
Yeah, certainly that is a home run, I think, for a lot of people. And people discovered that a while ago. It's easier to do that now. The challenges with that are, if anybody is getting inpatient care and they have gotten a lot of relief from cannabis, hospitals do not, the vast majority of hospitals have no inpatient use policy. They want to arrest you. They may take it from you if they see it and lock it up and give it to you when you get out, or throw it out or something like that. So, but it has certainly been helpful for that, for sleep, relaxing anxiety, for people who do not want to take benzodiazepines, or want to reduce benzodiazepines. Certainly, there's something there.
Yeah, and increasingly, international and societies in the United States are acknowledging that, right? And I just said, that study came out looking at CBG and anxiety. But the other thing that, like, we all know this, and it's been proven certainly initially in a clinical space with HIV patients way back in the 80s. But like, the reason people joke and laugh about kind of when they smoked pot in their dorm room was, right, it gave you the munchies. So the appetite piece is another big one, whether that's related to just relieving anxiety or improving pain or decreasing nausea. Sure,
right.
That might be also true, but just as an appetite stimulant itself, we know that there is an effect there.
Mm-hmm.
It's not going to work for people that are really kind of suffering from all kinds of symptoms and have gut effects of their cancer or other things like that. Like, it's not a miracle, but it's really one of the better tools we have to just directly stimulate appetite. We don't have a lot.
Yeah. And that's really, and it's a really interesting point that you make in terms of, how it actually works with appetite. And I find that to be most interesting. Is it secondarily increasing your appetite because you feel less anxious, you have less pain, right? So that trickle down effect that we could potentially see, really interesting.
We see this with everything, right? Your head is attached to your body. And so when people talk about, like, I want to use cannabis for sleep, but when we ask, like, tell me what's keeping you awake, and it's like, I have terrible pain.
Yeah.
Like, is it the cannabis that's actually fixing the pain, or is it just like putting you to sleep? Like, it's probably not either. It's probably a little bit of both, right?
Right. Yeah, really interesting. One of the questions that came in, because you mentioned anxiety as one of the top three that, it can typically help with, are around formulas for anxiety and depression, which you've mentioned, but looking for combinations that don't create a high. So is that, again, I think typically a patient may feel like, well, if I try something, I inevitably will get a high with it, but are there effective combinations or products to be used where that doesn't come along with it?
Certainly, and just to kind of put this out there is no good evidence for using cannabinoids for depression as of now. And so we have very, very good treatments for depression. We should not deviate from that. We're not there. There is no evidence. It's been looked at a lot of times. You know, maybe they'll find something in there at some point, but no. And certainly you can get a purely CBD, and through the EO platform, as you do that, it will, if you say you have kind of a low desire for THC or don't want THC or are unable to use it, it'll find a CBD only product, which are, you know, kind of largely available, and we source them in a couple of different places. And so you can stay away from THC entirely. Those are often hemp derived products. So those are things that you can get in a variety of different outlets. Then you get into, I saw one of the other questions in the chat, you know, how do you know if you're getting what it says you're getting, right? Which is true of like any supplement with vitamins and herbs and other
Right.
things, right?
Right.
And so looking for things like, you know, good manufacturing processes and a couple of other acronyms that are certificates of analysis that kind of, this is what you are getting what you say you are getting. I just did a little bit of a talk on that I knew nothing about melatonin. Somebody just asked me to add a slide in, and I added it in. And the range in a product like melatonin is from like 20% to 500% of what is labeled. And so just kind of keeping that in mind. That said, anything you buy from a dispensary, a licensed dispensary, it is analyzed a couple of times during the process. You're getting what it says you're getting. A product might be different from one time you get it until the next. These are plants. And so the compounds, you know, are all going to be similar for the same plant, but a different growth cycle. If that state is growing something outside versus in a more controlled environment, you may, you know, find it is a bit different. But yeah, you can certainly get all CBD products, or predominantly CBD, in dispensaries.
Perfect. Okay. And I know we have a few minutes left, so I want to quickly go through a last few questions with both of you to try to cover as much as we can. So, Dr. Worster, you mentioned we got a question about lower GI, diarrhea. So again, CBD, cannabis, effective for those sorts of symptoms, yes or no?
For diarrhea, I mean, I wouldn't, no, I don't think there's any evidence there. You can see that a change in their, it's called gastric motility, meaning like how fast your gut's moving stuff through, with higher potency cannabis products that, you know, some of the higher THC things can, in fact, like cause some diarrhea for people they see. So I wouldn't use it for either diarrhea or constipation. Like, I just think we have actually very good products out there that can treat either of those. So I wouldn't put that as a good kind of option.
Perfect. Okay. Thank you for that. And there were some questions that came in just in terms of cannabis use and potential risk for other occurrences, including, does it increase risk of stroke? Someone else said they heard medical professionals that say CBD and THC may promote cancer growth. Can you touch or clarify some of those myths or, you know, thoughts around cannabis use?
Okay, so it's really important about that stroke risk. The American Heart Association a couple of years ago did come out and say there is a potential increase in risk of any cardiovascular event, meaning like a heart attack or a stroke, associated with high potency THC inhaled products. And this isn't a surprise. We know that THC has a direct relationship on your heart rate, meaning the sort of more THC you ingest, either inhaling or eating or whatever, the much it can trigger your heart rate to increase, right? So the more that you increase your heart rate, the higher risk you have of putting symptoms on your heart or triggering a stroke, right? So absolutely. And one way to avoid that is don't smoke very potent, high THC products. Like, that doesn't really have a good medical place, I would say. Okay, so again, I'm going to go back to sort of what we were talking about before with the, like, does this is Dr. Google and Reddit and all of this, right? Because one camp says, like, there is this one study that I found that here it promoted cancer. And then the other group talks about like RSO and it cured my cancer and all that stuff. And like, all of that is unfounded. Like, please, 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 please do not read into those little bits that you get on the internet. you could try hard enough to find something that supports or refutes any claim you want to make, right? Like any substance out there can cause or prevent cancer. If you search hard enough to the ends of the internet, you'll find it, right? Probably even like water in some way. But none of that is supported by data, right? None of it is supported by data that it is going to cure your cancer, and no data supports that it is going to sort of cause cancer either. So like, just please take all of that and put it in the space of like, yes, the internet lies sometimes.
Weird.
Yeah, right.
Go figure.
Right. In terms of, so a couple questions also that came in just around THC use, cannabis use. If a person is on existing psych meds, perhaps for anxiety, depression, using that alongside, is that something that's recommended, really case by case basis? What do you typically say?
Greg, you want to take that one?
So certainly a discussion to have with whoever is prescribing your psychiatric meds before doing that. There is some connection between cannabis and serious mental illness like schizophrenia. Whether it's causative or correlated, it has been shown over and over again. And so if you're being treated for a serious mental illness like a bipolar 1 disorder or schizophrenia or some other something for which you're taking antipsychotics or other mood stabilizers, it is very much worth having conversation with your psychiatric provider or whoever's doing that. That said, Brooke and I have certainly seen people who have very stable psychiatric illness for many years and are needing symptom relief, and we have certified them, and because we have eyes on them, and they've done fine.
Well.
Yeah, they do fine. Well. Yeah, right. And so, like, not to exclude, but it's better to ask and better to kind of have others know, what you're doing.
I think the key here is, like Greg was saying, don't think of cannabis as a replacement for your medications for schizophrenia, for bipolar disorder, for major depression.
Yeah.
Think of it as kind of a tool to help with other symptoms, right? And it can reduce reliance on benzodiazepines for anxiety potentially. But that's more of a symptomatic relief rather than necessarily like a long-standing treatment, like we think of SSRIs and other things like that.
Exactly. Okay, that makes total sense.
And just to this one question here from in the chat about a woman who unfortunately broke 3 ribs, which is just an extraordinarily painful thing. Can I use cannabis to sleep? Yeah, probably you can. But if you have broken ribs, you're probably needing something else so you can sleep. So it is, there's not a good reason they cannot be used together. But
right, going to that symptom management. Okay. One final thought, just to round us out a little bit. If someone, because we have a national audience, if someone is interested in finding out how they could get their medical marijuana card, or if their state legalizes it, or wants to start that conversation with their physician, what do you say, or what advice do you have for our community?
Yeah, so if you look at the map of who has what programs, it's kind of very complicated. You can certainly, I would start by just looking at your state's website and seeing if you have a state medical marijuana program. If you do not know that, many states have what's called adult use, where you can just walk into a dispensary and do that. I really kind of, a sensible way to do this would be to kind of, if nothing else, profile on the EO platform, and that will tell you whether your state has a program. It will also find places where you can get recommended products. And so that's easier than kind of scouring the countryside in Idaho looking for cannabis,
And more and more products can be delivered to patients too. If you are in a rural area or a state that doesn't have easy access to this, there are good quality products that can be delivered. So I agree. I mean, I think asking the EO platform, there's a place where you can ask it and you'll get kind of, research and kind of medically tailored guidance there. And profiling will give you like, here's what it is around you. Here's what your options are as a way to start.
Perfect.
And how to talk to any clinician about it. Like, this is, just say it. And I know that sounds simple, right? But I know it, and there's a lot of other trappings that can be like, am I going to be judged, or am I going to get in trouble, or am I going to do all these things? And so it's kind of the way that you think about asking any questions that might trigger anxiety in you, is that like, if you can bridge that gap initially, right? Or walk across that bridge to just say like, I'm thinking about this, or I'm interested, or what do you know, or anything like that. You know, I think that at least rips the Band-Aid off to open the conversation.
Yep.
Don't be surprised if you hear back from a clinician like, I don't really know, you know, or that's not my thing, or whatever. But, you know, I still think that like having a space for those, you know, non-judgmental conversations and tying it to your kind of clinical care is important. So I would always encourage that.
I love that. And right, we'll put that link to the EO website to get started, to inquire, to create that profile. As well as share the email for our members to reach out directly. So thank you both so much for being here with us today. I know we just started to like skim the topic of this conversation, but I appreciate both of your time, sharing your expertise. And we're so thankful to have you as a partner of Unite First. So thank you both for being here with me today.
Thank you for having us.
Thank you. And thank you for everything you do for all the cancer patients out there. We see it on the clinical side, and so we're grateful for that. So thank you.
Good. It's good to be in it together.
Yep.
Takes a village. Bye, guys.
Bye. Thank you. So I know there were many questions that we did not get to this afternoon, but please know that the video segment that we did with both Dr. Worcester and Greg earlier this spring really dives in so much more of the details. So I highly encourage going to our video library, checking that out. The slides are also available. So some of that data they were speaking to, you'll find that visually in our video library. So again, I will go ahead and just share my screen as a little teaser for what we have coming up. So we've got a couple virtual hangouts next month. We've got our Ask the Experts with Dr. Toplinski happening with cancer and survivorship guidelines. And then we're tapping into cancer risk in the Jewish community, also that second week of August. So hopefully you will join us. Again, I want to give a big thanks to our education sponsors, West, Merck, and Daiichi Sankyo. Again, additional support from Lilly, GSK, Gilead, Pfizer, Immunogen, now part of AbbVie. So many wonderful sponsors to support us moving these conversations forward. So the video will be on our library. Thank you so much again for being here with us. Everyone, enjoy the rest of your summer, and hopefully I will see you in August. Take care.